Philosophy of medicine. Symptoms versus causes and catalysts. All non-genetic diseases in the human body that are reflected in a long-term failure of the immune system are symptoms rather than the cause. The survival self-defense mechanism. The biological survival self-defense mechanism is common to all organisms. The immune system is a part of this mechanism. Human beings have the most sophisticated mental mechanism for survival and self-defense. Symptomatic treatments usually cannot cure the patient, as they do not eliminate the causes of the disease. Recovery occurs only when all the causes of the disease, mental and physical, are resolved and eliminated. All parts of the body share the same initial physiology and immune system. 4 groups of non-genetic diseases that reflect long-term immune system failure: allergies, chronic inflammatory diseases, autoimmune diseases, cysts and cancer. A partial list of symptoms that the body uses for self-defense and survival. Physical: pain and discomfort, fever, nausea and vomiting, diarrhea, high blood pressure, allergies and inflammations, autoimmune diseases, cysts and cancer. Mental: there are many, such as denial. The first stage in the Kubler-Ross psychological model. The essential distinction between symptoms, causes and catalysts. Modern medicine has no clear philosophy regarding the differences between the causes of the disease, symptoms, triggers and catalysts. Pathogens. In the acute stages of infectious diseases, pathogens are indeed the cause of the disease. In chronic stages, the same pathogens are only triggers and catalysts. Because the human body is designed to overcome any intruder, it means that the self-defense mechanism does not work correctly. So the real cause is more profound. Long-term immune system failure causes are always a combination of these 3 major elements: an unhealthy lifestyle reflected in improper nutrition and high body toxicity, anxiety, low physical activities, lack of sleep, gut flora imbalance and parasite overgrowth, which causes heavy load on the immune system. Traumatic non-resolved mental and spiritual events from our past. Blocks body's chi life force energy, poor circulation of blood and other body fluids. Pain, fever, nausea, vomiting, diarrhea. Pain, or discomfort, is a sign that something went wrong. Pain is a warning sign and therefore part of the self-defense mechanism. Not having pain does not necessarily mean that everything is going well. Fever is a sign of inflammation. Not necessarily infection. Fever serves 2 main purposes. Fever boosts the immune system, usually with lots of sweat, weakens the resistance of the pathogens. Nausea, vomiting, and diarrhea are tools used by the body to remove toxins from the body. High blood pressure is a symptom that implies that filtering of the blood is not efficient. Therefore the kidneys, liver and heart are raising the blood pressure. High blood pressure is usually a sign of an unhealthy cumulative lifestyle. It can be reversed. Surprisingly, high blood pressure as a single factor is not the primary cause of heart diseases. Allergies are a number of conditions caused by hypersensitivity of the immune system to typically harmless substances in the environment. From Wikipedia. The body is not supposed to attack harmless substances. It suggests that something confuses the immune system. Allergies are an early warning sign that the self-defense mechanism is confused. Usually without pain, but with a decline in quality of life. Chronic inflammations. Inflammation is part of the complex biological response of body tissues to harmful stimuli, such as pathogens, damaged cells, or irritants. From Wikipedia. Bacteria, viruses and other parasites are tools that the body uses for self-defense. Common symptoms of inflammations are fever, vomiting, lack of appetite, diarrhea, sweating, frequent urination. They all serve one purpose of removing toxins from the body. The explanation for why antibiotics and other medicines cannot bring the cure to chronic inflammatory diseases is that they not eliminate the causes. Autoimmune diseases. An autoimmune disease is a condition arising from an abnormal immune response to a normal body part. There are at least 80 types of autoimmune diseases. From Wikipedia. The self-defense survival mechanism is a very sophisticated one. Making the body to attack itself means something in the basics went wrong. The variety of so many types of autoimmune diseases suggests they all have common causes: cysts and cancer. Cysts allow the working parts of an organ to be isolated from the damaged parts, thus protecting the organ. Poor flow of blood and lymph fluid can cause the body to produce cysts. Cysts are not the cause but a symptom of an organ that is highly toxic. The human body can reverse this condition with its unique ability to make cysts disappear, if the proper conditions prevail. Cancer is an advanced form of a cyst. What may seem to be a paradox, the self-defense survival mechanism may cause death. The mainstream position in modern medicine on this subject is more counterproductive than one might expect. Strengthening the immune system. Summary. All drugs interfere with the body's defense mechanism. The primary justification for using drugs is in emergencies or unusual situations, such as infants, the elderly, pregnant women. In reality, this is not the case. It is essential to have a unified medical philosophy that can distinguish between the causes of the disease, symptoms, triggers and catalysts. Recovery occurs only when all the causes of the disease, mental and physical, are resolved and eliminated. The theme of self-healing medicine involves many practical and philosophical issues. The sfhealing.com website provides a detailed, simple step-by-step explanation on how to practice self-healing medicine. Thank you for watching this video.